Well, welcome to this talk, and I'm delighted to welcome back Vibeke Manniche from Denmark. Welcome, Vibeke. Thank you for returning.
Thank you very much for having me back, John.
The really serious matter of the excess deaths. Now, we've been seeing excess deaths all throughout Europe and the world. 2020, of course, you would expect that it was the pandemic. 2021, again, you would expect that that's the pandemic. But what we saw is this excess deaths carried on into 2022. Now, we wouldn't really expect that because COVID deaths went down dramatically when we had the Omicron variant, which was so much less pathogenic and people were developing a lot of immunity by then. And the excess deaths are actually carrying on now into 2023. For example, in the United Kingdom, the week up to the 30th of June, I think it was 8.6% excess deaths. Which are still there. Now, I know you're planning on some research on this to actually get this properly done in research and hard numbers on data. But what got you interested in this to begin with, Vibeke?
Well, first of all, I must say we haven't had excess mortality in 2020. I mean, in 2020, we didn't have excess mortality. And yes, we had some death, with corona and without corona, but we didn't actually have excess mortality. And the funny thing is, we, a group of, scientists and doctors and statisticians, have been following the data from literally, day one, from where we had corona, the 28th of February 2020, and been looking into the data and whether we would have, this is solely on Danish data. I'm not that strong on UK data. I have some data now with the excess mortality, but from the beginning I didn't follow those data that much. So we didn't have excess mortality in 2020. But something happened, and it's very strange, and I still don't have an explanation. May 21. Then the excess mortality started,
Right.
and that's literally also in Finland, in Norway. It's like it's on a date. And the thing is, when we had the lockdown, because I don't know what the causes. I think there's a lot of causes. There's not just one cause. I think there's many causes for that excess mortality. But what happened when we had the lockdown? The first thing I said to anyone who dared to listen was that this will cost lives, because the minute you closes down a health system, the minute you closes down the hospitals, the where the practitioners, the minute you closes down, then you will have delay diagnosis, delay treatment, delay rehabilitation, and so on. So I at that point I expected, that was just me making a guess, that in 1.5 years we would have excess mortality, but we literally had it before. It started out in May 21 in Denmark and several other places, and it just continued, and that is very strange, and it's very depressing. So we have been looking in and following these numbers, and you have a graph of that, which I think is very interesting, because there you can see that it's the same pattern. And as a doctor, and as we said before, talking about prevention and how can you prevent morbidity and mortality, how can you, have people to live a long and healthy and, fulfill their lives, then that has been, for me, as a doctor, really, really depressing to watch this, from the side and kind of looked into these data, and you just saw it, continue. And what you looking into at the graphs, that is numbers taken from mortalities, and you see the numbers in Denmark, Finland, Norway, and in the bottom you also see UK. And I can tell from that as you said, you had some excess mortality also in 2020, which if you go further up and look at our and look at the Denmark, you can see in 2020 it was fine, nothing to talk about, literally nothing really. And then there was a little starting in the start of 21, and then it fell, and and we were looking into the data and kind of, oh well, that's fine. And then bang, in May 21 it just raised, and just recently it has stopped So this is a accumulated data. So this is like, if we go and look at the Danish data, at least 60,000 people has died more than, you can always say that everyone who dies shouldn't die, but excess mortality more than expected. 60,000. That's for a population about 5.6 million,
Yeah.
citizens. But the interesting part is that this is not only a Danish phenomenon, it's also in Finland we saw it, in Norway we saw it. You can see it's almost like you just copied the graph.
I hadn't noticed that before. That
No,
Finland there,
no.
the deaths didn't start till well into
May,
2021.
exactly, May 21.
Yeah,
I mean, it's literally, it's like we've been sitting, different places and watching the same thing happening. And you see,
and
the same
Norway.
happens in Norway also. And then it just continues up, up, up with the excess mortality. And
Yeah,
that's like, if I saw that as an epidemiologist, I would expect, well, did you copy something? Did you take the date when you know what's happening? But it just shows how bad the corona handling was. For me, this is man-made. For me, this is a sign of a humanity crisis really put on the public by the governments and the authorities, because this has nothing to do with COVID, coronavirus as such. This has something to do with the handling of what happened. And if you saw the UK data, I think it was around 150,000 excess, in UK, and it's a horrific number, because, as I keep saying, these are names, these are someone are still crying, still missing, heartbroken and so
oh
on.
yeah,
So this is like people having a name. And I think what really, maybe the worst part of it is that we haven't really been allowed to discuss this excess mortality. It's like every time you want to discuss it publicly, mainstream media, it's just kept down, no, don't mention it. It's like, let's just put it under the carpet. Let's pretend it's not there, but it is there, and it's for real. And you can look into the data that it's not only a Danish problem, it's not
oh
only
yeah.
a problem in Finland. We just had a very excellent study from Germany showing that they also had and still has, excess mortality. You have and still has more than we have in Denmark, excess mortality. So it's a huge, humanity crisis really, and it's quite frightening. For me as a doctor, I think it's very frightening.
I really hadn't noticed this trend before. So in the UK, the excess mortality started in 2020. In Denmark, Finland, and Norway, it didn't start till basically halfway through 2021. Have you got any
Yeah.
sort of provisional explanations to explain that difference?
Um, well, something must have to do, of course, with demography, to have to do of way of living, have to do of way how the health system works, rich and poor and all that, I mean, something must have. But when you look into the data from Norway, Finland, and Denmark, we quite similar to Scandinavian countries, also demography and middle, how long you live and all that. So I think that's more comparable, really.
Yeah.
And for that reason, the Scandinavian data shows something which is varying, because in UK, I also been following the discussion in UK. There could be a lot of explanations, and was it this and that, and did we have a cut down on this, or what happened? But when you looked into the Scandinavian, this is not random. I mean,
No.
this is not like something something just happened.
No.
This is non-random. This has something to do with whatever happened. And as I reckon, it's multifactorial. I
Yeah.
mean, it's not just one thing going on. And I'm quite sure, and we know that from studies already, that if you have a delayed treatment, if you have a non-treatment, like we saw with heart attack, you get, a bigger damage or injury of the heart. And that in the end, proceed to heart failure, and the end, early death. So we have several good explanations also about the excess heart mortalities, which you have in UK. We may have that also. We just don't have the data yet publicly, which you have, and it shows that that is the price of the lockdowns. That's for sure. I mean, when you lock down the health system, when you took away the ambulances, when people didn't go and have the treatment for their heart attacks, they sat at home and thought they were not allowed to come. They were afraid for corona, whatever it was. And if they went, they were not allowed to have their, their relatives. And we know that, relatives is quite important when you go through serious illness. Someone to, give you love, someone to take care of you, someone to comfort you, someone to make sure that you get your treatment and so on. And they were denied access. So I think it's many, many reasons for that. And that's why I call it human, man-made, really, this excess mortality. And that's why I think it's so important to discuss and learn and hold it, of course, because that's the next problem. What on earth can we do to stop that, that development, which it seems like we have been, it's stopping now in you could see that from the graph also in Denmark, Norway and Finland. But then what are the learning out of it? What happened? How can we make sure that it's not going to happen again? And so I also think that some of it may be due to loneliness, social isolation, psychiatric diseases, suicide. And then in the end, we also have the discussion whether some of the excess mortality could be explained, and I'm not saying it is, but maybe could be explained by the vaccinations. We still don't know. So some of it we know for sure that it was the price of lockdowns and closing down the health system. And the ones who may be still in doubt of that, I keep saying, well, if you think we don't need the health system as it works, when it works, why on earth have the health system then? If you think that you could have the same results by locking down a health system, closing doors, only taking the acute patients and so on, why on earth build up a big health system? So it's bollocks really to say or pretend or don't think that it didn't matter. And I could see that the British Heart Association also had these explanations, so that's fine. But the thing about the vaccinations, that's still unclear. And it's a funny thing, because if you go back to the graphs, John, you will actually see that we put in where the vaccination started. You see
this line,
and that's just we have been doing that along the way when we made the graphs during also the corona crisis. It's always, I wouldn't say fun, it's an improper word, but it's always interesting to see when something happens, when something changes, whatever it is. And that's why we have put that into the, graph, because someone will argue that the excess mortality also are associated with the vaccinations. I'm not saying it is, because we don't have any data yet, at least we don't have in Denmark, who shows that it is or isn't. So it's only speculative. But of course, that's also obvious to take into account, especially in the view of our own study, where we could see that some batches seems to give more, reported side effects than other batches, which may prove that there could be a safety issue with some batches. And if there has been a safety issue, let's say you have some batches, as our study showed, which gave more reported, side effects, well, of course, then you could expect that there could be, also a higher all-cause mortality. And that we're trying to look into. But I still think, and I'm getting back to that, but I still think it's interesting to see how close to that where the vaccination started and continued. We have to remember that continued with one, two, third, second and third vaccination. So this excess mortality actually followed also the start of the vaccination and the continuing vaccination. And then again, I'm not saying, and that's very important for me to, underline that, I'm not saying that it are the vaccinations. I'm just saying that it would be wrong not to have that, take that into account also. And that's why I keep saying it's not just one explanation. It's just not one cause for the excess mortality. It's definitely many causes.
Yeah. Do you think post-COVID sequelae could be part of the long-term mortality as well? Actually, damage done to the organs as a result of the COVID infection?
Well, everything is possible, but from what we know from the studies and that, no, nothing more than, I mean, you have to remember we also have post-flu. People also have like a long, now we have long COVID, but we also have long flu. People also get, side effects from flu and get worse and worse. So I would still expect that it would be more or less the same patterns as when we had like a flu season or a pandemic and so on. So no, not really. But then again, all I'm saying is that it is multifactorial.
Yep.
But one thing is for sure, and we know that already from data, as for data on heart attacks and that, we know that when we had the lockdowns and people who had heart attacks, the damage on the heart was at least 25% bigger than, outside of the lockdowns, which, confirms that you need the treatment for the, heart attacks. And if you had such a big damage on the heart, you will die sooner. So it's like, and we have now with cancer the same story, that people didn't get the treatment and the diagnosis. So of course, if you have a delayed diagnosis, a delayed treatment, you will die earlier. So all I'm saying is that we have to look into this, but it has to be in a transparent way, and it has to be an open-minded discussion. And that's what's been lacking really, because when the numbers are so varying as they are, you can, look at these, and these numbers we just showed, John, they are officially numbers. I mean, this is not numbers we have been doing this or that to. Yeah. These are actually the official numbers. And when they are that obvious, of course we are, we need to have that discussion. We are demand to have that discussion to save lives, to prevent that it continues, and to do whatever we can to save people. Because as it is also now in the UK, people are dying, I would say, for no reason, but they shouldn't be, because it's too many.
Following your excellent paper on the vaccine batches, do you plan to use a similar research methodology now to study the excess deaths?
Yes, and we already, going ahead with that. First of all, we're going ahead with having our data updated and see if there are new data we can put into, and see if the pattern is still there, that it seems to be 3 different ways of having the side effects, that some batches tend to give more side effects, others less, and some none. So that we look into. But also we are trying to look into all-cause mortality, to see if one would expect, I'm not saying it's so, but one would expect, and especially now since there's been, been a time period, someone would expect that people who had the blue badges, the badges which most reported side effects, that there would be a higher mortality. So we're trying to get those data, but I must admit that we are having a little of harassment from the parties where we're having the data from. They're trying to withhold the data from us, but eventually we will have the data, because we have our rights to get those data. But we are looking into it and very, very eager to get that, so we can put it together and see whether we will find that pattern or not the pattern. And that's science in its essence, that we need to have the data, we need to have the real numbers, because otherwise we will just stick to guessing really, and now I'm guessing that there will be a pattern, but we need to have that documented, or the other way around, showing that that's not the case.
you're not guessing. You're postulating a hypothesis.
Exactly. Yeah.
And I think it's important to mention a hypothesis is a testable statement.
Yes.
It's testable. You put forward a hypothesis, and we can then go on and test this.
Exactly.
Because one hypothesis would be that the people who had more adverse reactions from those batches that gave more adverse reactions, we would expect, if we followed those people up in a longitudinal study, that they would develop more sequelae as a result of, for example, tissue damage. But of course, that's a hypothesis. We have to test that based on the actual data.
Yes, and it's a more proper way of explaining it. You're quite right. So it is a whatever.
Yeah,
yes,
hypothesis.
Hypothesis.
I'm glad we're not doing this interview in Danish.
No, exactly. I would say so.
It.
It would be more easy for me at least. No. But you're right. So that's the right way of putting it. And that's of course what we're doing. And that's of course what's our arguments for doing it. And as you said yourself, one would expect that there would be, maybe not now, maybe within a year or two, but one would expect, or at least that's also that there will be a higher all-cause mortality enclosed to the, the blue badges. Yeah. But still, it would be wrong of me if I said that is the case, because we still don't have those data, and that's why we're trying to get hold of those data, and will in the end, of course.
So what we need to do is get the data to you, then you can test that hypothesis, and you could say, you know what, we were completely wrong. These people made a full recovery. Or you can say, look, this hypothesis is substantiated. These people are dying at a much faster rate and getting other sequelae at a much faster rate. Until we've got the data, we can't say that. In fact, it's not a matter of being right or wrong. The data will either support or refute the hypothesis. There's no emotion here.
And I think we're really, we have to do it. I mean, there's a demand, as I see it. We have this idea. We have this we have this speculation about, and an obvious thing to speculate about. So I think we are demand. We should go. And I also, in the end, I literally think this was something the authorities should look into. I think this was actually something, I mean, we are happy to do it. We've done it already, for the last 3.5 years. We've been looking into these data, in our spare time, or, all for free. But literally, we have someone who get their, monthly pay to do this job. And I think, it's quite devastating, or it's quite sad, or it's quite, I don't know what's the right word, but I think
disappointing.
Exactly, that they're not doing it, because, as I said before, these are actually costing lives. I mean, this could be your and my family. This could be the ones we love most in the world. This could be ourselves. I think it's such a big threat toward the population. And if you saw how much energy was spent, money was spent, on this crazy, corona psychosis, on this, whatever it took. I think in Denmark, it's just billions were being used on all these matters. And, nothing really happened, at least not in Denmark, with the mortality. And here you have and here you have like, an apparent and obvious excess mortality, and no one seems to care. And that's just even more, we're living in a crazy world, because people are dying, people are losing their, loved ones, and no one seems to care. And that's really, really strange. And that's why I'm saying the authorities should literally, in the end, look into these data, because they have those data already.
And that's what they're paid to do.
Exactly. And that's what, our tax money goes to. So we should actually expect them to do this. But we're very happy to do it and continue our work. But I still think that there's someone who should, as part of their job, has been doing it already, and, keep doing it. But that's not the case.
And people who don't have to fight for the data. You have to fight for the data. Now, are you confident?
And I think that's very, I think that it's harassment. It's an harassment, that's the way to put it. And we can see from how they have behaved, that's the Danish Serum Institute, we can see how they have behaved, how they have, tried and harass our work. It's actually quite disgusting, really. And it's like it's their own data, no, it's public data they are just taking care of and, managing. So I think, but then again, that's because our study actually did point out that someone who was, and still are supposed to look after the safety issue and the safety signals actually didn't do their work properly. And that seems to be the reason why they try and harass us. But in the end, of course, we are, allowed to have those data, and we're just waiting to get those, because we can quite easily start to make that statistic analysis and then continue that and see if something will happen, or if it's just, as you said before, refute that combination or that connection. That would be fine also. That's literally science in a nutshell, that you say you have a hypothesis, you have an idea, you test that, and either it's right or it's wrong.
Absolutely.
And that's why we all are so eager to get and dependent on also for the future health, public health.
Are you confident that in time you can get the data of who was vaccinated, who wasn't, how many doses of vaccine people had, what adverse reactions there were, what long-time morbidity and mortality there was, and be able to correlate these two variables? I mean, in other words, are we going to know the answer to this question at some point in the future?
Oh yes, I'm quite sure we will. I mean, it's just a matter of time, because they can't keep the numbers away from us and the data. No, so they're not allowed to that. So we will in the end. And also from the data we have already, we are now trying to look more into the qualitative. Look more into which batches. Did we see a pattern? Which batches gave myocarditis? Which batches, was there some batches giving more tinnitus? Were there some batches giving more muscle aches and all these strokes, heart failure, whatever? So we have already a bunch of data which we could look more specific into and see if we can see a pattern of symptoms and so on. So we still have a lot of data we can look into. We have a huge amount of data, but it's just that this will all cause mortality, especially with now where the excess mortality is so obvious, because for 1 month, May, June, and then you expect, all right, July, maybe it would fall. But as we saw on the graphs, it just, continues, now flattens, but still. So now it's so obvious that we need these data desperately, either to say that is the case, or the opposite. No, that's not the case. Both answers are we eager to have. So I'm quite sure in the end we will get the data, but none of us likes to be harassed. We talked about that earlier. It's so frustrating and it's so unfair and it's so not scientific. I mean, as I explained earlier, usually you have a very polite tone within scientists and that, and for some odd reason, just that one place and one professor at that Serum Institute is so rude and not understandable how you can behave like that. But then again, you will see people now and then behaving improperly, but that shouldn't keep us away from getting the data. So we will get the data, that's for sure. But it's frustrating.
Yeah. So over time, we'll be able to correlate doses and vaccine batches with diseases and morbidity. And we'll get a positive correlation and mortality. We'll get a positive correlation. We'll get a negative correlation. We'll get no correlation. But sooner or later, we'll get that. And once that correlation is established, it will then be necessary for the people in laboratories to come up with pathological explanations for that.
And that's the next part, because
to explain that in terms of biology.
Yeah, exactly, and that's the next part. If that is the case, that some of the excess mortality are also based on vaccinations, then of course, why are people dying? Is it turbo cancer? Is it myocarditis? Is it heart failure? Is it, heart problems of one sort? That is, of course, the next explanations. What's actually happening? Sudden death syndrome, what's happening when people die? Well, people has always been dying suddenly, but if will there be a pattern? Will it have something to do with spike proteins? Would it have something to do, with a buildup of that in special organs? I mean, all that, then we can get that explanation. So I keep saying that it's all a bit of the puzzle. So in the end, there will be a bigger picture. And I think also, if you look at the firms behind like Pfizer, I think actually they should be looking into these data. They have
I suspect they are looking into the data, Vibeke.
They are probably.
Just that they're not telling us.
No, they are probably, but they should, and we have a demand or desire, and both, to have those data. But nevertheless, we have the public data, and it would be quite, I wouldn't say easy, but it quite easily we could start out and see if there was a connection, as I said before, with all-cause mortality, and other scientists could do the same. I mean, that's also a point that none said that this was only up to us to continue. I mean, I would love if someone else, had these studies and published that also, because the more we get and the more data we get, you could see how much we learn from the data from Denmark, Finland, Norway. The more we compare countries in between, the more we see a pattern. Because if you and I just have had one of the graphs today, let's say from Denmark, then someone could say, well, that's probably the Danes, they don't know how to live, so they died, a whole bunch of them,
It's obviously obviously the Danish lager causing that.
Exactly, there you go. They drink too much, and all that. But then when you see suddenly the different countries and you see the pattern, suddenly you say, oh my God, something weird is going on here. So we learn a lot from Danish data, from UK data. I'm very happy with ONS because they publish much more than the Danish authorities does. And
not perfect, but it's better than nothing.
It's much better than Danish data, which we can't get hold of more than 2 years ago, and there's such a delay on that. But nevertheless, we keep learning from all these data, and in the end put together a picture, and that's what it's all about, really.
Well, thank you so much for your work, Vibeke. I know it's self-sacrificial work, and I'm remarkably reassured to learn that eventually we are going to get answers to these questions due to the sheer tenacity of people like yourself working through the opposition, working through a good scientific process, using valid, well-established scientific techniques. It has to be said. These are there. It's just a pity that people aren't being more facilitative, saying, look, here's your data. They should be coming around knocking on your door, giving you the data.
Exactly. They should be standing there eager to give us the data and, begging us to look at the data as soon as possible. Also the politicians, because I think that's also interesting that they are silent. If I was a politician going into politics to save the world, to save humans, to, all this and that, I would also be knocking on the door and saying, oh, give them those data ASAP. Let's have the, the answer tomorrow, or even better, yesterday. Let's do something. But they're also silent, which astonishes me, and it's just crazy. And I can't really understand it, because I think a lot of people has the same drive as you and I have. And, went into politics and went into become a doctor or whatever for the same reasons. And I simply can't understand, exactly as you said, why they're not, hammering on the door and say, oh, please, here's the data, look into it, let's see what's the answer. But instead they, lock the door, try and silence you, try and harass you, defame you, all that. It's, I simply can't understand it.
Well, I think you were being very generous there, Vibeke, to the motivation of politicians, but we do believe that some people are genuinely want to be public servants. So let's hope those people step forward and are able to take charge of the
maybe some
situation.
forget, maybe some forget on along the way
Yeah.
what got them going in the start. But I still believe the best in my human fellows, that most of them has a good drive, and a good, and just people. So I think, but then again, I can't imagine that people go to work every day just to hurt others. I simply can't imagine. I mean, there may be a few, but most people, they will try and to get the world a better place to be. And I still think that lots of people think that what they're doing, that's what they drive, or at least I hope that that's what they're doing. And it seems like someone forgot that along the way, as it is for now.
We need to get back to the idealism of our youth, don't we, when we really wanted to
Exactly.
make the world a better place. You do get, like, life's experiences do tend to knock it out of you, but we need to go back to that and renew our efforts that we are genuinely working for the benefit of all human beings, and you are. And it's great to see.
I think actually it's an important thing, and also I think I've been doing that along the way as a doctor, and I'm quite sure you've been doing the same. I think it's very important now and then, and to remind yourself, why did I go into this field? What was my drive? What did I try to achieve? What did I try to make a difference? And I know for sure what my drive is. That is exactly to get more people to have a happy life, children to have a happy life, a longer, a happier, healthy life, and with the loved ones. So, but you're right. Sometimes we tend to forget, the drive of the youth if we don't keep reminding ourselves. And that's what, at least I'm trying to do along the way.
Absolutely, yeah. I have one last question, Vibeke. Will you come back and give us the data when you've got it?
Oh yes, that's for sure. I love being on your show, John. I think it's so funny, so I'm very happy. No, I must say that you're doing a tremendous work. I know that a lot of people are watching your videos, and you're making a big difference. So I'm so happy to be on your show, and I will definitely come back whenever I have something we could share with your public. So you'll definitely hear from me again.
Thank you very much. And of course, as well as helping people, this form of work, this form of analysis has got the benefit, which is only a benefit. It's not really why we do it, but it is also absolutely fascinating. So
exactly,
it does make it easier to do. Vibeke, as always, a total pleasure. Thank you for everything you're doing, and we're really looking forward to some firm data as soon as you've got it, and we'll look forward to that. Thank you.
Thank you, and thank you for having me.